Have you ever looked at your hairbrush after brushing and felt a knot of dread in your stomach? Do you see more and more strands of hair circling and drain every time you shower? If you're finding clues of hair loss everywhere and it's starting to worry you, please know this: you are not alone. Millions of people worldwide, both men and women, are fighting the same battle. But the critical question is this hair loss just a natural process, a warning sign from your body, or is it something we can actually manage and treat? Stick with me in this video and you will get a complete, clear understanding of what's happening and what your real options are, from the root causes to the most advanced treatments available today. Hello everyone and welcome back to my channel. For those who are new here, I'm Dr. Jamalvandi and this is where you break down complex medical topics into actionable, easy to understand information to help you live a healthier life. Why is my hair falling out? Understanding the enemy. کلاً جزء تیتر بیار. First, it's essential to know that shedding 50 to 100 hairs a day is completely normal. In some articles, they said that about 150 is normal. The problem begins when that number increases and new hairs don't grow back to replace them. The causes of hair loss can be divided into two main categories: controllable factors and genetic predispositions. The primary causes of hair loss in men and women: androgenic alopecia, male and female pattern baldness. This is the most common cause of hair loss globally. In men, it typically appears as a receding hairline and balding in the top of the head. And in women, it usually involves a general thinning of hair over the central part of the skull, with the frontal hairline often remaining intact. This type of loss is rooted in genetics and hormones, specifically the sensitivity of hair follicles to dihydrotestosterone or DHT, Telogen Effluvium. This is usually a temporary but very common form of hair loss. In this condition, a large number of hair follicles suddenly enter the resting that calls telogen phase. The triggers include significant physical and emotional stress, for example, after major surgery, bereavement, or high work pressure. Hormonal changes like childbirth, menopause, thyroid disorders. Nutritional deficiencies, especially iron, zinc, vitamin D, and vitamin B12. Severe illnesses and high fever. Sudden changes in medication. Nutritional deficiencies. Crash diets and unbalanced eating can deal a heavy blow to your hair's health. Protein, iron, vitamin D, and biotin are key building blocks for hair growth. Autoimmune conditions like alopecia areata, where the body's own immune system attacks the hair follicles, causing patchy, often circular hair loss. External factors: overuse of chemical, constant heat, styling, blow dryers, flat irons, and tight hairstyle like tight ponytails can lead to traction alopecia. How can I tell if my hair loss is genetic? This is one of the most frequent questions I get. To figure this out, you need to look for a few key clues. The pattern. Look at your pattern of hair loss. Does it resemble the pattern you've seen in your father, grandfather, mother, or sister? Genetic hair loss usually follows a predictable pattern. Age of onset. Genetic hair loss often starts gradually at specific ages. In men, it can begin in their late teens or early 20s. In women, it often becomes more noticeable after menopause. Speed of loss. Genetic loss is typically a slow, gradual process over years, unlike telogen effluvium, which is sudden and rapid. Notice that we don't have any exact experiment that can say definitely it is genetic or not. So just with the questions that the doctor asks you, they can just guess it is genetic or no. Consult a specialist. The best and most reliable way is to see a dermatologist or a hair specialist. The doctor may perform a hair pull test, examine your scalp and hair in detail using a device called a trichoscope. In some cases, order blood tests to rule out other causes like nutritional deficiencies or thyroid issues. The key takeaway: even if your hair loss is genetic, it doesn't mean you're helpless. There are effective treatments to slow it down, stop it, and even partially reverse it. Hair loss treatments, from simple solutions to modern technology. Now, let's get to the helpful part. The choice of treatment depends entirely on the cause of your hair loss. General treatments and lifestyle changes. Address nutritional deficiencies. A simple blood test can reveal your vitamin and mineral levels. Under a doctor's guidance, you can take necessary supplements like iron, zinc, or vitamin D. Stress management. Techniques like meditation, yoga, regular exercise, and sufficient sleep can have a stunning impact on reducing stress-related hair loss. Proper hair care, using mild shampoos, reducing the frequency of heat styling, and avoiding tight hairstyles. Minoxidil. This is an over-the-counter topical treatment suitable for both men and women. It works by increasing blood flow to the hair follicles, stimulating growth and slowing down loss. Finasteride. This is an oral prescription drug primarily for men. It works by inhibiting the conversion of testosterone to DHT, the main culprit hormone in genetic hair loss. It is important to know that this drug must be used under medical supervision. Modern clinical treatments, mesotherapies, and PRP. Now, let's talk about two very popular and effective in-office procedures, mesotherapy and PRP. Mesotherapy for hair. In this procedure, a cocktail of vitamins, minerals, amino acids, and sometimes medications like minoxidil is injected directly into the targeted areas of the scalp using very fine needle. How it works? This nutrient-rich cocktail directly nourishes the weakened hair follicles, improves local blood circulation, and prolongs the growth, anagen, phase of the hair cycle. About sessions, you typically need an initial series of 4 to 6 sessions, spaced 2 to 4 weeks apart to see initial results. After that, maintenance sessions are recommended every 3 to 6 months. PRP, or platelet-rich plasma. This is a completely neutral treatment that uses components from your own blood. A small sample of your blood is drawn like a blood test. This blood is placed in a centrifuge machine to separate the platelet-rich plasma, which is packed with growth factors from the other components. This concentrated plasma is then injected in the targeted area of your scalp. How it works? The growth factors in PRP act as powerful stimulants, awakening dormant hair follicles, strengthening existing ones, and promoting new hair growth by increasing blood supply. About the sessions, similar to mesotherapy, an initial series of 3 to 6 sessions 4 weeks apart is common. Maintenance sessions are then done every 6 to 12 months. Which one is better for me? This decision should be made after consultation with your doctor. Sometimes combining these two methods yields even better results. PRP, because it uses your body natural growth factors, often provides a stronger and more long-lasting results, but it is also typically more expensive. Advanced treatment. Hair transplant. For those with more advanced baldness who have resistance follicles in the donor area back of the head, a hair transplant is a permanent and highly effective solution. So, to summarize, hair loss has many causes from genetics and hormones to stress and nutrition. A correct diagnosis is the first and most crucial step. For genetic hair loss, topical and oral medications can help. To boost results and stimulate regrowth, modern procedures like Mesotherapy and PRP are highly effective in office options. Remember, the key to success in treating hair loss is patience and consistency. No treatment shows results overnight. It usually takes 3 to 6 months to see visible effects. If you found this video helpful, please support my channel by liking this video and subscribing. Let me know your questions in the comments section below, as I will be answering them in future videos. I hope this information empowers you to take informed steps for your hair health. Thank you for watching, and I'll see you in the next video. Take care.